Good afternoon. Welcome to Startup Reporter Live. We are yet with another session on our interaction with Mr. Dr. Amarnath ji. And today's session is going to be really interesting because, first of all, we are actually interviewing him our first guest doctor who is coming on our Startup Reporter. And we welcome you, sir, on board. And thank you very much for giving us the time uh, to talk to us, to talk about your occupation, how was your journey so far, and to be very honest, I understand that how much difficult it is for doctors right now to take and devote time for such interviews. Thank you very much. Um so I would just like you to take the instance how you initiated and just introduce yourself to our audiences about yourself. That would be really great if you introduce yourself by yourself. It will be an honor for our people.
Yeah, I am Dr. Amarnath Upadhye. I am a laparoscopic surgeon. I primarily trained from KEM Hospital, Bombay as an undergraduate. Way back in 1976, I joined the medical college. Then by 84, I was already an MS general surgeon.
Mhm.
After that, my actual training began and I started learning more about surgery. In 1986, we started experimenting with laparoscopy
Mhm.
and the basic laparoscopic surgery. By 1992, I went to Israel on a fellowship
Mhm.
and learned laparoscopy. And ever since I came back, this progress in laparoscopy is continuous. I am
Mhm.
learning something every day and trying to improve every day.
Well, that's really nice to hear that, sir. And to be very honest, because since the COVID has evolved into our journey, the doctors has played the vital role, and how the entire segment has been facing because you've been the front warriors. So how and what led you to start a journey into a doctor profession? I mean, what was the thought process when you were as a kid, when you were as an aspirant, why you chose to be a doctor? Because in good
A
old
lot of
times
attraction,
in good old times out
a
there,
lot
your
of
doctors
attraction towards,
so
lot of
you
attraction towards the field
uh-huh,
of my own grandfather,
uh-huh,
who was a doctor of his era.
okay,
So since my childhood, I always wanted to become a doctor.
okay,
In spite of the fact that I'm very good in physics, chemistry, and mathematics,
uh-huh,
I stick to biology and came to medicine because that was one of the dreams.
okay,
And so I saw the amount of social work he did in
uh-huh.
his own profession in a small village. But I was very impressed and I wanted to emulate him. I wanted to follow in his footsteps. So I joined the medical college.
Wow. So how was the journey so far? How much how's the journey? First, let's go into the journey aspect. How exactly and what exactly has happened so far? And so you have just given us. Just tell us how was your college days? That would be really great if you can share certain. I'm like, how was those college days, early college days when there was no internet? To be very precise, when there was no internet out there, you don't have the facility to google the about anything and then you read it from there. So if you miss the classes, you miss the entire concept. So how was the journey over there in that particular era where you were being actually doing this?
Primarily, unlike today, our time was not taken up 50% by WhatsApp and such stupid things.
Uh-huh.
We used to utilize more about actually reading stuff which was real to us. We
Uh-huh.
used to attend lectures which were real to us. We
Uh-huh.
were not distracted by WhatsApp, internet.
Uh-huh.
In internet is a very good medium.
Uh-huh.
You can have information as well as misinformation.
Uh-huh.
I want to remind you of a saying by Mark Twain, one of the great humorists in America.
Uh-huh.
He said that if you don't read the newspaper, you are uninformed.
Of
And if you
course.
read the newspaper, you are misinformed. So
Yes.
that misinformed part was not there in our life. Whatever
Yes.
was there was to see and read from the book And we used to actually see the bodies and we used to actually do the experiment, and all that was the focus.
Yes,
Distance
absolutely.
was not there. So life was simpler, a
Mhm.
little more on track, and not so distracted.
Yes. So absolutely, sir, because even when I was a kid, and because I started my journey in 2005 and 6, and during that, internet was just ramping up. But fortunately, I was really happy that when I was completing 10th and 12th, the internet was not that much prevalent, and we were happily working. But my next question would be that how you choose your specialization into your laparoscopic format. Why laparoscopic? Because in early times when you were talking about that in 86 and 84 or in 90s, when you went for your fellowship, laparoscopy was a particular technology which was under development phase, I believe so, if I'm not wrong. It was
Yeah.
not so many equipments are there for the laparoscopy. Um, the modernization techniques were not there. So how and what led you to thought about to go for this particular specialization?
One reason was I was always impressed by the gynecologists doing laparoscopy because they were the first people who started doing laparoscopy.
Okay. Yeah.
Though their procedures were very small
Uh huh.
and very limited,
Uh
like
huh.
tubal ligation and taking biopsies, etc.,
Uh
we
huh.
realized that if you just turn the scope around,
Uh huh.
you can look at the intestine, you can look at the omentum, you can look at the liver,
Uh huh.
you can look at the large intestine. So, out of this curiosity, we somehow, me and my senior colleague,
Uh huh.
late Nazareth Hillary
Uh huh.
from KEM, we started doing laparoscopy, diagnostic laparoscopy first
Okay.
in 86.
Mm-hmm.
And we started looking at liver swellings. We started looking for the reasons for the ascites, ascitic fluid.
Yeah.
We started diagnosing cases of portal hypertension
Mm-hmm.
and how the vessels are actually dilated in the abdomen. We
Mm-hmm.
started looking for tumors.
Mm-hmm.
We started looking for ischemic bowel disease. We started looking for all this slowly over a period of time, taking a biopsy here, taking a biopsy there. At that time, there was no CCD camera.
Yeah.
So we had to see through our own eyes only. And no
Yes.
one else knew what you're seeing. So you had to do the biopsy yourself through a
Okay.
small cut somewhere else.
Uh huh.
And somehow with primitive instruments doing that. On top of that, giving general anesthesia was a concept which are non-existent. We
Yeah.
were considered too unimportant to be given general anesthesia for.
Mm-hmm.
So we used to do all these laparoscopies in local with some sort of injection.
Wow. That's really
And
tough.
and there was no carbon dioxide.
Uh huh.
So I remember going to Crawford Market and
Mm-hmm.
buying a fish tank pump to push
Okay.
in air, like we push in air in the fish tank pump.
Yes. Yes. I know.
Same fish tank pump was used to inflate air in the abdominal cavity. And
Oh.
that's how we basically started. Slowly.
Mm-hmm.
There was not much of a support from the department.
Mm-hmm.
There was not support from the department till CCD cameras became improvised.
Yeah.
The thing did not pick up. So that was the time when I went to Israel in 1992,
Okay.
where it was still infancy, but all the basic instrumentation was in place,
Yeah.
like the camera. It was not very good, but it was there. You could see something.
Mm-hmm.
Insufflation with carbon dioxide had become established.
Mm-hmm.
Then monitoring of patient had become established.
Mm-hmm.
So at that time, it was in infancy. They also used to do in Israel. They used to do either gallbladders,
Mm-hmm.
rarely appendicitis,
Mm-hmm.
and still more rarely hernias. That's all they used to do.
Okay. All
But
right.
when I came back, when
Uh
I
huh.
came back, I started doing and experimenting myself
Uh huh.
on various things. By that time, there was a new site or portal site
Mm-hmm.
called as Web Surge,
Mm-hmm.
which was, I think, Zoom from France.
Mm-hmm.
You could become a member of that free of charge,
Okay.
and you could watch videos online,
Uh-huh.
and on that video we learned a lot what we had
Oh,
not learned before.
okay.
So now we started slowly learning and improving.
All right. So you're talking about the primitive stage when the internet was under the dial-up network, and that time also, you people took the timeline from your daily routine to saw those videos and learn from those particular videos, which were
Yes.
being routed from France. What you've been saying out. Wow,
Yeah.
that's impeccable. I mean, I don't have words for that. Um, so from my perspective, I think there is a huge myth about laparoscopy, and there is a lot of confusion because usually what happens, because nowadays people are half aware customers, what we call them up, because of the internet search. What they try to do is they just type the word on laparoscopy and then it starts taking all the details on the internet, which creates more myths and confusion in the mindset of people. And I'm sure that you have gone through with that sort of patients as well, that when you are suggesting somebody about the laparoscopy, they try to go with certain excuses or certain sort of inhibition factors. Now, my prime
Yeah.
question is, what exactly is laparoscopy? If you can simplify in a simple words, that would be understood by a common man.
See, laparos means abdominal cavity.
Okay,
What the abdominal cavity is called laparos.
okay,
So laparoscopy, or also called peritoneoscopy,
uh-huh,
is the same thing. You make a small cut,
uh-huh,
go with a small tube inside,
uh-huh,
inflate the abdomen, see something,
okay,
and in area, and then decide the treatment. So that
okay.
is primary laparoscopy.
Okay, okay. All right. Thank you very much for that. I think now that clears out the primarily the most important question, that what laparoscopy is all about. Now, my other question to you is, since you've been doing a lot of, you're handling a lot of cases out there. Now, most of the time, since the COVID has prevailed into the factors, what is the kind of patients you've been facing nowadays? In terms of your particular segment? I mean, are they still skeptical, or they have certain different inhibitions during the COVID timeline? Because you mentioned certain points over there as well. That earlier it was not because of the general anesthesia. So how different it is there now from the past and from
There have
COVID
been
past year?
two differences, two
Okay.
major differences.
Yeah.
One difference comes from the surgeons themselves.
Hmm.
Initially, someone from Italy published a paper saying that the concentration of viruses
Hmm.
in the abdominal cavity is
Hmm.
far higher than the concentration of viruses in the lung of a COVID patient.
Hmm.
So that gave us the scare that if we do laparoscopy in a patient who is COVID or is just recovering from COVID,
Hmm.
his abdominal fluid will contain so much virus
Hmm.
that we'll all get covered. The whole OT will become dirty. The whole OT will become bad.
Hmm.
Everyone will get infected, etc., etc. But fortunately, that myth was broken very quickly.
Okay.
We realized that there is a certain modification by which you can suck out all the fluid,
Uh-huh.
suck out all the air in a
Uh-huh.
specialized suction machine which goes into a Savlon bowl,
Uh-huh.
and that is the virus. So it doesn't have to necessarily come on everyone. Number one.
Okay.
Secondly, what happened was patients were basically worried about coming to a hospital at all
Yeah, absolutely.
because no one knew what kind of patient will be there.
Mm-hmm.
Laparoscopy being a hospital-based specialty, you
Mm-hmm.
can't do laparoscopy in the outpatient department. It
Mm-hmm.
requires a proper anesthesia, it requires a proper setup, it requires a proper admission facility, a
Mm-hmm.
regular operation theater. So people
Mm-hmm.
were basically worried about coming to a hospital to
Mm-hmm.
get treated. They would go to a clinic, but
Yeah.
they would not come to a hospital. Slowly, over a period of time, since June 2020, I have been doing surgeries almost regularly.
Okay.
and I have not come across any problem. Of course, we do these patients like we do triple virus, HIV, oxygen antigen, and HCV.
Mm-hmm.
We have added RT-PCR COVID to that.
Mm-hmm.
Then we get a patient HRCT done, CT of the chest done,
Mm-hmm.
to see that he is not actually infected. Reason is it is bad for everyone. It is bad for the patient. It may be bad for us,
Mm-hmm.
but it is worse for the patient. Because if a patient is suffering from COVID and if he undergoes even a simple surgery,
Yeah.
the complication comes to 40 to 50%.
Yeah. That's
So there is no point in putting the patient to that kind of unnecessary exercise
mm-hmm.
for something which can be potentially life-threatening. But the condition is improved a lot.
Okay.
Condition
Okay.
is improved a lot. In a lot of these cases, we are proving that they are negative, and
Uh-huh.
then we have to take.
Okay. So coming back to my prime question again, what are the myths you have faced so far with respect to laparoscopy? What are the common myths? अगर एक सिंपल भाषा में बोले कि एक laparoscopy के लिए बहुत ज्यादा कॉमनली मिथ्स क्या सुना है आपने जो कि कभी कभार आपको जो है हंसा भी देती है कि अरे यार ये कैसी बातें कर रहे हो, ऐसा कुछ नहीं होता है. सो ऐसे कुछ कॉमन मिथ्स.
Yeah, for example, some people feel that laparoscopy is not a right kind of surgery, and that open surgery is better than laparoscopy.
Okay.
Okay. On the other end of the spectrum, you have people who will ask for laparoscopy for everything.
Okay.
Even if something happened to their hand, they want laparoscopy. Now, ultimately, they have to understand that laparoscopy means abdomen.
Okay.
So, any abdominal disease can be approached laparoscopically
That's
to a reasonable good degree,
Uh-huh.
especially anything in the pelvis
Uh-huh.
and anything under the diaphragm can be very easily treated laparoscopically.
Okay.
People also feel that laparoscopic hernia, especially umbilical hernia and some other hernias, are necessarily better way of treating them. That is
Okay.
also a myth.
Okay.
Rather than treating laparoscopically, it is important that be treated properly.
Okay.
Treating something properly
Uh-huh.
is as important or even more important as
Uh-huh.
necessarily treating something laparoscopically. Laparoscopy does not mean success.
Okay.
Especially I'm talking about hernias.
Uh-huh.
Hernia is a dynamic surgery. Hernia is a surgery in which we are repairing the abdominal wall, and that abdominal wall has to stay repaired. So there are patient factors, there are surgeon factors, there are tissue factors, there are so many other factors. So for hernias, laparoscopy is not necessarily the panacea which can do right to everything. It is not that simple.
Okay.
As far as inguinal hernias is concerned, I think laparoscopy and open surgery is hardly any difference. More or less the same. Laparoscopy.
So, continuing with the part, sir, as you've been aware that myths are always there, but then when you break them up from your part, that okay, this is something which is for you, which is not there. How difficult it is for you sometimes for making those customers understand that this is something for you, because most of the time when because of the internet facility, now most of the people come across with the mindset or a notion that either I want to go with this or I don't want to go with this. So how difficult it is there, how difficult it becomes for you to make them understand.
As a matter of fact, I would put it the other way around, because of internet, I tell all my patients, we give them the information and we tell them, please look it up on the internet, the positive and negative features of laparoscopy, the positive and negative features of what surgery I have proposed to you. So you find out from the internet. That way, I think it has become better because I don't have to keep on explaining again and again and again the same thing.
Okay.
We half the people they don't understand. But if something is printed on the internet and there's a huge number of amount of literature, then they can say find out pros and cons on the internet for say this particular disease. They get the answer. Then we explain to them that look, you want laparoscopy for this particular purpose, but this particular disease is it is possible that we may have to give up laparoscopy and do open surgery if the condition so demands.
Okay.
But you read about it, and unless until I put in a laparoscope, I will never really understand what exactly has happened.
Okay.
We draw a beautiful picture for you. The stomach lies here and the intestine is here, and this to explain to you. In real life, it is not like that. In real life, गॉलब्लैडर के ऊपर ही डिओडोनम होता है, उसके ऊपर ही बड़ी अंदर की होती है, उसके ऊपर ही सब कुछ होता है. So people understand that laparoscope, the gallbladder is at the north pole and the intestines are at the south pole. That is not true. So we explain that to them. That understanding that put in the scope and have a look. Sometimes if a person is able to understand and appreciate. I have even called people inside by donning a gown. I have called them inside to show them the pictures.
Okay.
So with this kind of technology and the advancement in technology, things have not remained that difficult also.
Okay. Okay.
There are people who have that baggage with them. They have certain preformed ideas.
Yes, absolutely.
But it is easy for the younger generation to understand what is new and why is it good and why is it not good. Whatever it is.
Okay. So things have
improved a lot.
Yeah. So so technology is working as a boon in disguise, or we can quote it as boon in disguise format. Moving on to another section of ours, that is the inspiring section for the youth. So, as you're aware, because this is very important for us to talk about this, because nowadays, specifically, I'm being able to see here that a lot of people are committing suicides in the very early stage for no reasons, and we call it as a depression, and for a merely simple problems as well of what they've been facing in their life. Maybe they have failed in a particular exam, they don't know, or there is any such comment which has come up, or somebody has just there is a huge problem what they felt that I cannot compete in this particular exam, and they are committing suicide on that. It's really important, so that's why we've been putting this section, that how to inspire, instead of going with the entire inspiration lectures. uh, how do you tackle your problems during your college days, when you were a student, when you were actually reading about things? And of course, in every person's life, success is not something which is at 100% stake. Even in medical profession, in every particular profession, problems come, we try to face it, we try to tackle with them, and then move up with the better spirit. The intention has to be go up, and the effort should be go up. That's what my belief is. If you can throw some light on this, that how you tackled your problems during your college times and now, and how you've been moving up.
When I was a student, we had the science is a science stream or commerce stream or arts stream.
Yes.
If you go to, then you either become an engineer or you become a doctor.
Yes.
If you went to commerce, arts, you either became a lawyer or a CA or whatever. They're fixed fields.
Yes.
Life is much more open today.
Exactly.
What you can become a dentist, but if you understand that your actual strength in life is managing individuals,
yes,
then you can leave this and go there. Idea is not to restrict yourself and your potential.
Absolutely.
What we say as a scholastically intelligent person may be in real life a disaster, because see, he cannot manage people.
Yes.
He is socially unintelligent.
Okay.
He is emotionally unintelligent. So, scholastic intelligence is not the end of everything. Number one. And rather finding out who is the best in the class. Our education system should find out what is the best in every student.
That's true. That's absolutely true,
And
sir.
nurturing that ability, has to be nurtured. It takes longer. It takes more effort on the part of the teacher. It takes more effort on the part of the entire system. But
Mm-hmm.
that's the only way to go forward. Everyone, it is like asking a group. I saw a cartoon
Mm-hmm.
that Einstein is sitting, taking an interview,
Uh-huh.
and there is a monkey,
Uh-huh.
there is a monkey, there is a crane, there is
Uh-huh.
a fish, and there is a small mouse.
Uh-huh.
And anyone who can fly will fly with flying colors. Only crane has a chance. Fish
Yeah.
poor doesn't even stand a chance.
Yeah.
Monkey doesn't stand a chance. So our system is a bit like that.
Yeah.
Our system only for scholastic intelligence and scholastic excellence.
Uh-huh.
There are
Uh-huh.
other areas of excellence. There are other areas of excellence.
Uh-huh.
And if each student is seen in that light
Uh-huh.
by not only his teacher, by his parents, that he's this quality is very good, that this boy is observant, that
Uh-huh.
this boy is paying attention to what everyone is saying.
Uh-huh.
He remembers certain things very well. So this boy should go into a field which will give justice to his social intelligence
Yeah.
rather than his book intelligence.
No.
Unless until we come to that pass,
Uh-huh.
the problems and stresses will continue.
Absolutely.
Okay, number
Absolutely.
one.
Uh-huh.
Number two, lot of other fields have remained open and become open
Uh-huh.
with a new education policy which the Prime Minister has outlined.
Yeah.
You can do arts, you
Uh-huh.
can take a subject, you can come back and do something else.
Yeah. Absolutely.
The same system which is there in America, that you do pre-med or you do certain subjects like humanities, for example,
Yeah.
religion, for example,
Uh-huh.
and then still come back to science and learn science.
Yeah.
So that sort of system will basically encourage people of various ideas
Uh-huh.
to merge together. Something will good will come out of it. I am very hopeful for the future of India
Uh,
because our mindset has to change. We are stressing ourselves too much only in one way of success. Success can be earning money, or you
mm-hmm.
can be miserable.
Mm-hmm.
Success is doing a lot of social work and you have no money, but you are very happy.
Well,
And
absolutely.
ultimately, man needs what? Man's needs
Mm-hmm. Hello.
are
So your network has been down, I believe.
you are
Uh,
and that will solve the problem.
yeah. So actually, I believe your network has gone down.
Even those people who want to come for medicine,
Mm-hmm.
medicine is a brilliant, very great field. Only thing is, don't come into medicine only to earn money.
Yeah.
There is a lot of job satisfaction. There is a lot of things we can do for people. There are a lot
Uh-huh.
of things we can do for poor people. So all this, you have to basically be empathetic to try and understand the other person's pain, physical, emotional, whatever it is,
Uh-huh.
and try to help. Money will come by in every profession. If you pursue a profession passionately, money is going to
Uh-huh.
come. How much is a matter of luck, number one, and your own ability of generating. But if everyone starts comparing himself with Ambani,
Yeah.
then it is going to be stressful.
No, that's absolutely there, sir, because even Ambani has not raised in a day or so. So what I have been talking to every particular person. So I was quoting because I'm being myself as a motivational speaker to most of the places, and
Okay.
I always say this thing that it took 9 months for you to come into the planet. All right, it took almost an year for you to start crawling, 4 years for you to start talking, 14 years to start understanding what is good for you and what is bad for you, then how can you think about that a success will come in a day or so? And there is no, it's not a destination that you thought about that I'll from Delhi to Ahmedabad, I'll travel and my destination is Ahmedabad and my success is at Ahmedabad. That's it. Whatever you have achieved in your life, it is just a milestone. So once you have achieved once, so for the person, when I was a student, what I said that when I was a kid, 10th standard was a milestone that if you get more than 90%, it is your success ratio. If you get in 12th, you get into PMT or scores, a better scores, that is a success. But once you have achieved that, there is nothing which has been sustained forever. Once you are into a job, I personally said to a couple of people out there that once you start your job, for the first time you will be asked what is your CGA CPA percentage, but later on nobody is going to ask you. It's all how much work you have done. Uh, Moving to very next question. Uh, Hello, hello.
Yeah.
The network is down. Actually, I believe. Hello.
तुम्हारा नेटवर्क नहीं आ रहा है अभी अभी आ
It's there. So usually, what exact in this particular segment, what I call it as the funny part. So एक बहुत बहुत बड़ा मिथ रहता है कि डॉक्टर्स हमेशा सीरियस मोड पे ही रहते हैं. यू हैव टू गो अहेड क्योंकि डॉक्टर्स के पास पूरे दिन में जो है इतने ज्यादा पेशेंट्स और इतना सारा कुछ चल रहा होता है, तो उनके पास सिर्फ सीरियस मोड होता है बिकॉज दे डोंट वांट टू गेट डिस्ट्रैक्टेड फ्रॉम देयर मेन एजेंडा ऑफ लाइफ ऑफ ट्रीटिंग पेशेंट्स. तो इसके अलावा उनको और किसी चीज के बारे में पता भी नहीं होता है. बट हाउ यू एंटरटेन योरसेल्फ, आई मीन कैसे कैसा रहता है कि घर जा करके वो दिनचर्या के पूरे दिन वो पेशेंट्स के साथ में माथापच्ची करने के बाद आप घर जा रहे हो और एक अलग से एंटरटेनमेंट के लिए. सो हाउ हाउ यू एंटरटेन योरसेल्फ.
तो क्या होता है कि वी आर ऑल्सो लाइक एनी अदर कॉमन पर्सन. We also have, I also have a wife, I have a daughter, I have a son who never agree with me on anything. So we are always, I also buy vegetables, I also go and buy fruit, I also stand in the queue in the bank, I also do all these things. Maybe sometime I'll outsource it to a driver, whatever. But most of the times I am doing all these. Plus listening to the square cuts by my wife. You know,
Yeah.
you know the square cuts. ये सब हमको होम मिनिस्टर से सुनना ही पड़ता है, तो उसमें कुछ चॉइस है नहीं.
मतलब
भले we are all like human beings. We are trained in a particular branch. We do that to the best of our ability. I want to do only one thing.
Okay.
Like Buddha has said, no, your only aim should be becoming a better individual than what you were yesterday. A better professional, a better individual, a better father, a better son, a better, better individual as compared to yesterday. Beyond that, nothing else. Nothing else is true. Everything else is a myth.
Yeah,
Doctors
absolutely.
also using have also same kind of rage and anxieties and everything the same. Whatever position you are, your anxieties are different. I have a problem of 4 lakh rupees today. Ambani has a problem of 25 crores tomorrow. So
Of course.
the scale changes, but the stress is the same.
No, that's
So
absolutely.
fun also is the same. Everything is the same. There's no difference. We
So
are all
maybe
like human beings, normal human beings.
I can quote it as that you are thinking about to clear an exam. I am thinking about that I have already cleared that exam. How I'll make it implement, and you are still thinking about the mistake that if I'll make a mistake I'll not clear it, and I'm thinking that if I'll make a mistake, this person is not going to make it. So every person has a different stress level, and every person has been working out day and night in term of improvement. But yes, the growth, it always depends on the improvisation. The more you improvise from and learn from your mistakes, so that is where being there. So, but I really like the quote that you have. You are also facing the same part of day-to-day course, because usually doctors felt like कि कोरोना के बाद तो डॉक्टर्स को जो है एकदम ऐसे सराखों पे बिठाया गया है कि घर पे भी डॉक्टर साहब आ रहे हैं तो जो है कुछ नहीं बोला जाएगा, बट घर जाते ही जो है सब्जी नहीं लाए, ऐसा कुछ
ऐसा
नहीं,
कुछ नहीं है,
ऐसा कुछ नहीं, ऐसा कुछ नहीं है। यहाँ का गेट बंद हुआ तो फिर अपने को डर ये लगता है घर जा करके क्या सुनने को पड़ेगा।
नहीं, हमने भी बर्तन मांजे हैं, हमने भी घर साफ किया है, घर धोया है, सब
अच्छा
कुछ किया है, जैसे दूसरे लोगों ने किया हमने भी किया है,
अच्छा, वो भी है।
कोई फर्क नहीं। हाँ,
It was really pleasure connecting with you, sir, because I think we have already come up to a closure part. So I have only one thing to ask you, the rest. What are the three important advices you want to give to the medical aspirants, number one, to the youth of our nation, and to the people who are actually working to the doctors? Because that is also very important.
see, basically, first advice to people who aspire to become doctors is, it's an excellent field, it's a very exciting branch. Whatever branch you go in afterward, it's an exciting field. It will always be here to stay.
Mm-hmm.
Doctor's position in the society and in general will never go away, number one. Number two, you are in a very, very important profession, so be empathetic to people.
Mm-hmm.
Okay, rather than just excelling technically,
Mm-hmm.
excel in human relations,
Mm-hmm.
talk to people,
Mm-hmm.
and don't think only about money.
Mm-hmm.
I don't think many doctors think about money. Some do.
Mm-hmm.
Like every field, there are a few black sheep.
Yeah.
In doctor's profession, there are a few black sheep.
Mm-hmm.
Thirdly, what is important is whenever you do something,
Mm-hmm.
this is what I have learned in the Corona time when I started reading our Upanishads and our Puranas and Hinduism in general.
Mm-hmm.
Hinduism tells you that abandon the sense of doership,
Mm-hmm.
that I have done this. This ego has to slowly go away.
Mm-hmm.
You have to imagine that this job is being done through me
Mm-hmm.
by higher power. You may call it God, you may not even believe in God. But you have to believe, as long as what you are doing is honest and for the benefit of everyone, whether you have done it or you haven't done it, doesn't make any difference. So if you are keeping yourself safe and grounded, if you think that it is being done through me, not by me, not by this individual,
Mm-hmm.
but through some force which is acting through me for the betterment of this patient.
Okay.
When that sense comes,
Mm-hmm.
then your result also will improve. You will
Okay.
make right decisions. You will not
Okay.
make decisions based only on something.
Okay. Yeah, that's
Same
true.
for doctors. For people who work with us,
Mm-hmm.
they are doing their work properly. Idea is to improve them
Mm-hmm.
by not shouting at them, but to gently telling them
Mm-hmm.
where they are going wrong and be patient with them.
Sure.
See, these are not trained individuals.
Yeah.
They come into nursing profession, the nursing training is for 2 years, 3 years,
Uh-huh.
and you can't expect them to become an expert nurse immediately. So they also require grooming.
Yeah,
Like
absolutely.
we require grooming, they also require grooming. Idea is not to shout at people. If
Yeah.
you shout, if you feel that your work will be done faster, you are totally mistaken.
Absolutely.
Your
Absolutely.
work will be messed up
More
because
definitely.
they don't have the ability to stand in front of you, let alone
Absolutely.
doing the work. So idea
Absolutely.
is to be empathetic to people in general
Mm-hmm.
and give them longer rope. Slowly over a period of time, they'll improve. You
Sure.
will come to know who's insincere, who's very sincere. You will come to know. And similarly, you treat the people accordingly.
Sure.
But I think being empathetic is the most important.
Yeah, absolutely. Absolutely. Thank you very much, sir, for giving us the time. We are really in depth with you. It was pleasure connecting with you. We'll definitely look forward to get more and more insights from your end, and we'll definitely
Okay.
try to reconnect with you. I hope you have enjoyed the same. thank you very much for devoting your time. All right. Thank you very much.
Yeah.